Welcome, everybody. This is Matt Seefeld. I'm the Executive Vice President here at MedEvolve. What we're going to learn about today on our webinar is understanding the financial impact of the COVID-19 virus and making sure that you are well prepared for the short term, but then also the long term as we come out of this global tragedy. You know, our lives have changed dramatically. I live in Southern California where we've been in lockdown. And so the things that I used to do in my normal cadence of life have been turned really upside down. Having schools closed and daycares, having to quickly move to really video conferencing in all aspects of our lives, shortages at the grocery stores, fear and natural isolation has just been a challenge, and we're trying to figure out if there's an end in sight. Let's talk about how this virus is wreaking havoc on healthcare. We are a practice management company. We also have revenue cycle services for many, many clients across the U.S. And we're having to plan rapidly for declining revenues and understand our fixed costs and understand, the timeline in which we get back in action as our clients get back in action. You think of the hospitals, clinics, it doesn't really matter whether you're a private practice, surgical specialty, or primary care, or you're a large academic medical center, you're feeling it. The elective surgeries being postponed, closing down of the ASCs, obviously the drop off in patients. A lot of our clients are starting to convert rapidly to telemedicine, which is a great option. Being able to see supply shortage, safety concerns for medical professionals, and of course, increase in sanitation requirements, all of which 4 to 8 weeks ago was not something that we thought could happen. And here we are. Just some tips here. This was from the AMA. Making sure that you all have a plan in place for rapid decision making. The models I'm going to go through today are real time. You need to be real time now. You can't be running reports and doing pivot tables in Excel. You need real time analytics to tell you how bad things are getting and also how fast the turnaround is happening. Looking at outstanding financial obligations, looking at contingency plans, right? You've got to make sure you understand how to continue your business operations. Obviously, there's a lot of furloughs going on. There's a lot of reduction in force. Understanding the stimulus packages and what that does to you is going to be really important. So let's talk about financial forecasting using analytics. For those of you that have heard me before talk about what we've done here at MedEvolve, right? We leverage AI, we leverage machine learning and really data science to bring analytics to a whole new level. And we've done the same thing now on the financial impact analysis for our clients. But any of these methodologies I talk about today, you should be able to do. Certainly, your practice management vendors should already offer these for you. If not, you need to start talking and having those discussions with them. When you look at some of these variables that you need real-time insight into, right? It's reduction in appointment volume. What does that mean? Are my new patient visits, established surgeries, high dollar injections, low margin, high dollar injections, right? What is that change happening day by day? Looking at your decline in charge volume. A lot of our clients had a charge lag, anywhere from 2 to say 10 days. And so they didn't start really feeling that impact until the latter part of last week. And now certainly we're seeing it this week. Net revenue loss. So not only when you're going to lose money that should have been coming in if business was going on as normal, but the timing of when you're going to lose that money. Is it 2 weeks from now, 4 weeks from now, 6, 8? Do you have time to plan and strategize? Looking at your current ARs has never been more important because that's going to allow you to have a little bit of additional cash flow coming off the balance sheet. But when is that going to come in? Looking at conversions in telemedicine, making sure you understand your canceled visits and then what percentage of those visits have been rescheduled, right? And what's that offset? When we look at the financial impact on canceled visits, we start to look at a few things here. One is you need to understand what your historical baseline is, right, for visits based on the appointment category, right? So it could be surgeries, it could be your new patient visits, established visits, et cetera. Then what you need to do is you need to understand what's actually been taken off the books. And so that's really your variance count there. You can see for this group, they've already had 11,133 appointments canceled in the future, or in this case, over the next 90 days. That should have been on the books. Then you need to do is you need to apply an algorithm that estimates the net revenue, right? The collections you would have received based on the payer and based on the appointment type, right? And that's how you get to your net revenue loss. So for this group, you can see that, overall the hit so far is $1.5 million. And then you can see those different buckets. And so over the next 15 days, they're going to see a hit of 155,000. Second half of April, 195,000, and so forth. So again, a lot of variables here, but you need to have this stuff, and it needs to be real time because you need to keep an eye on that number and when that money's not going to come in. Let's talk about impacted charges. Obviously, with canceled visits, you're going to start seeing a huge drop off in charges. So this is critical. You need to understand your historical baseline. So we take a last 7 days compared to the prior 28 days, and we look at 2019 compared to 2020, and that helps build in seasonality and because it looks at rate of change. But you can already see in this example, that variance is sliding. And a lot of folks increased their charge masters this year. We have a lot of clients that have improved reimbursement with certain insurances through negotiating better contracts. So in theory, 2020 should be much better than 2019. And so you can see here that this client in particular is starting to slide off big time in 2020. Let's talk about impact to cash flow. When you have decline in services, obviously it's declining in charges, and based on your payer mix, you're going to have different levels of impact to cash flow. And so, a couple things here is one, you need to understand period comparisons, right? So in our case, as I mentioned on the slide before, we're looking at 2020 compared to a 2019, same period of time. But you also have to start paying attention to the drop off in insurance payments and even the drop off in patient payments. And we're going to talk about that here shortly. But if you look at the red box down below here, you can see that in 2020, you're already seeing a rapid decline in charges, right? I mean, 24 million compared to 32 million the prior year period just for the week ending 3/28. Then you start looking at insurance payments. Now, you haven't really seen an impact to insurance payments. Average days to pay is anywhere from 14 to 21 days. And so our clients are starting to see that drop off, and you will as well. But again, you got to be able to keep an eye on that and see how bad it's getting. All right, let's talk about current AR, right? So you got our account receivable sitting out there. The question is, what's the value of that AR? We have algorithms for our clients to estimate that liquidity, try to give clients good transparency into what they can expect to collect. And again, you should have this as well. So keep in mind, these are basic things in revenue cycle management. This is basic things that most practice management vendors should already be offering. The key here is that not all AR is good AR. And so one of the things we did for our clients was we wanted to exclude things such as denial, such as past due that's patient responsible, stuff that hadn't been filed yet, and even partial pays. And the reason why is we need to make sure we understand good AR that's fairly guaranteed. Because if I'm a provider and I say, hey, I got 6.5 million sitting on my open AR, and the value of that is 4.1 million, am I going to say, well, looks like I'm going to get $4.1 million? Absolutely not. We know that this stuff takes time to pay. But the bucket here, this first grouping here, this 0 to 14 down to the 75 plus, that is pretty much a sure thing, right? And let me talk about that. So one of the things that we look at is that if you are out on the active AR, you have not received an insurance payment, you have been filed, of course, you are not outside of your average days to pay. And what we do there is we know our average days to pay based on the insurance plan. And so we take one standard deviation on the front and the back of that to say, hey, our average days to pay is within this range, right? They haven't gone outside that range yet. And so, and there's been no first pass denial on the claim. And if there has been a denial, it's for patient responsibility, right? High deductible, then we exclude that. So what we have here is we have a very, very clean group of AR, and you can see, it is not the 4.12 million. It's going to be substantially less. But this is the time frames here. This is the money that I would tell a client that you should be getting in a relatively solid period of time. And so these buckets over here are actually when you're expected to get it based on the average days to pay. So if I'm talking to a client, I'm going to say, look, you're going to get $505,000 in the second half of April, right? And you're going to get another $144,000, really in that first week and a half of May. Okay. I'm spending a little bit more time on this than the other metrics because this is really important when you think about furlough schedule, keeping staff on. If you're going to furlough, I highly recommend you don't start with your AR team, right? You got to start with your charge entry coding because those volumes have dropped off. Payment posting obviously would be next, but not right away because remember, you got a lot of AR coming in, a lot of cash coming in off of AR that was booked, over the last 14 to 30 days. And AR would be the last, folks. If you have super clean AR, I get maybe a more rapid furlough schedule. If you have some aged receivable, insurance receivable, let's say more than 20% over 60 days, you want to keep the AR team in place. You want to make sure that they're working that age stuff that they maybe haven't been able to get to in a while. So this is an opportunity to clean up the balance sheet. Let's talk about runout on denials and AR. One of the things here, so we'll go back to the slide, you can see that for the denials up top, there's about $742,000 in cash value in claims that have received a denial or one or more denials. You have to make sure that you can categorize and classify those ANSI codes, right? And so what we do for our clients is we roll those ANSIs up into classifications here, and you can see. But then you have to do is look at the cash value, and you have to say, is this going to be a hard or impossible denial to overturn, or is this a soft, something that, maybe a phone call to the patient to get the right COB or the right eligibility, or maybe it's a quick change to modifiers, right, or adjustment to coding, or maybe just submitting medical records to get the claim paid. You need to understand that. So the boxes in red are just some samplings of things that would be very difficult to overturn. So I would not count on denial revenue, right, net revenue coming from authorizations, timelies, uncovered services, obviously, benefits match. Even medical necessity is going to be tough. Again, understand your AR, understand your denied AR, and understand the buckets of that denied AR to say, hey, is it reasonable to think I'm going to get some of that, as you remember, $742,000 up there in the upper right coming in. So let's talk about rescheduling. One of our large urology clinics actually had given us this idea. Again, the stuff is rapid. We're building these models out real time. And, the question was, hey, I understand how bad it's going to get. Can you give me a little silver lining, out there? And I said, well, what would you like? And this was one of their physician leaders. And he said, well, I'd like to know how many of the canceled visits over the last 3 to 4 weeks have been actually rescheduled. In the next, over the next 90 days, right? So what's that offset? So this is what we built out, and now it's live for our clients to use. This will tell you that, while we have a large amount of cancellations that haven't been rescheduled, you can actually see there that a lot of them have been. And what's important to know is that, and this, by the way, this is your net revenue, right? So you can see that right now, canceled visits make up 821,000, right, that have been canceled over the last 3 weeks. But if you look at that 821,000, you're going to see that 316,000 has yet to be rescheduled, but 505 of it actually has. So that's a good sign. Now, does that mean everything's fixed? Absolutely not. But you need to make sure that you're rescheduling patients appropriately. And you also, we're going to talk a little bit towards the end at how when we come out of this chaos, how you need to make sure that your surgery schedules are aligned with your best procedures, your best appointment categories to really set you up for a strong cash flow in those first 60 days, okay, to make up for some of these losses. The other thing that I would just say on the rescheduling piece is, you really need to understand the true financial impact, right? And so to be able to understand that, you got to understand when was it canceled and what the value was. So you can see from the prior side, there's your 821,000. That's the weeks that these things were canceled, right? And there's your economic loss in those weeks. But on the bottom one, part B down there, is actually where you're going to see the reschedule date, right? So those are the weeks that have been rescheduled, right? And so that allows you to say, hey, my 504,000 has been rescheduled. And you can see for this client, they've actually rescheduled a lot at the end of April, quite a bit in early May and mid-May. So there's a lot of money on the books. Now, look, let's be honest, right? At the peak of this virus, it doesn't actually occur until middle to late April. And depending on where you are in the country, those may have to push out further. But you have to, and I keep saying, you have to have real-time analysis, real-time information to make these decisions. These are not planning for 3 months. These are planning for 24 hours. And you got to have the analytics to support that. So in summary, we will weather the storm. We will make it through. It doesn't have to watch Chris Como talk more about the fact that we will come together. We are coming together. We're supporting each other. We will come out of this better for it. But that doesn't mean it's not going to be really difficult, right? We are at war. And being at war, we've got to make sure that we have the analytics and the transparency to make the right decisions in real time. I talked a little bit earlier is that when we do come out, you've got to make sure that you can handle the scheduling volume, right? Everything from phone calls to looking and understanding the types of things that are being requested. Like a lot of patients, especially for elective procedures, are waiting and waiting and waiting. They need to get help, right? It could be a knee, it could be a shoulder, it could be a hip, depending on your specialty. I mean, it could be lots of issues that were not considered emergent, and so therefore they had to wait. Well, they want to get on the books, right? You also don't want to lose to competitors. So if once you're ready to go, you've got to make sure your schedules are efficient, your providers' schedules are efficient, then they understand the importance of having a really, really busy few months when we all get back to business, right? And in order to maximize your net revenue, which helps offset these lost revenue, for this period of time, you got to make sure you're getting the right patient types and the right payer mix on your schedule. So again, for our clients, which are your surgical specialties, your private practice physicians, right, ones that haven't necessarily sold to private equity or moved into a hospital employed physician group, it's more important for you to make sure that you manage your schedule properly so you're ready to come out strong. Now's the time to figure it out. And you got to have analytics to do it. So again, I hope this was helpful. I hope you have the tools to do it. This data is readily available in your practice management system. You don't need to pull in EMR. You don't need to pull in cost accounting, right? These are basic PM data points, but you have to have the tools to grab the right data in the right way to build out these models. So I hope I gave you some good information. If you have questions about MedEvolve or the things that we do or the solutions we offer or services, don't hesitate to reach out. Stay safe out there. Stay quarantined. Let's get through this together. Got to make some self-sacrifice right now for the betterment of that 10% that are really at risk. So God bless everybody and have a great day.